in great part triggered by some of the recent pollution incidents, the ITC fire, Intercontinental Terminal Corporation fire, as well as down in this area. Virtually everybody remembers May 10th as the day that the barge collision on Bayport Channel happened, and there was an incredible stench that spread across this area and actually went, I know there are people here from Friendswood, and felt bad enough that they came within an iota of leaving the area for the day. They stayed inside their house all day. Likewise, all the way to Pearland. And then I read later, and thank you to the Houston Chronicle for doing such great coverage on some of these things. I found out later that benzene was found in that same plume that headed south at one point in Kemah and Baycliff. And so it's time that we start paying a lot more attention to these things. There's been a lot going on. I've been very involved with all the flood issues, but this is one I think that as the petrochemical industry grows in leaps and bounds, if we don't decrease the rate of accidents, that means we're going to have more accidents. So I don't want to get, I shouldn't take up all the time here, but I wanted to welcome you today. Restrooms in the back, drinking fountain in the back. If you have anything else you need, let me know. I'll be wandering around. And I'll be wandering around because I have a great moderator tonight, Dr. George Guillen, from the University of Houston Clear Lake Environmental Institute of Houston. And he's a busy, busy man, and I saw some of his past career positions, and looks like he's worked for every public agency I can think of related to the environment and the great outdoors, and he's still doing it. But with that, I'm going to hand off to him because we've got a lot of speakers. We have a lot of information. We've done these kind of meetings before, and the trick is people have to be fast and hit the high points, the most important points of their presentations, so that we can hear more and get more perspectives. And then at the end of the meeting, toward the end of the meeting, we'll have about 15 or 20 minutes of a panel discussion, and we'll be passing around index cards before that for questions. And we'd like to get most of the questions then. If there's time in each of the speakers' slots for a question or two, we can do that also. With that, I'm going to hand it off to Dr. George Guillen.
Before we start with our speakers here, I just want to say a few things about this whole meeting. It's very timely, and obviously we're going to be talking about two specific instances, but I think we need to be considering the general problem that we continue to see almost continuously in this area. And my interest, like Doug says, goes back many years, but started when I was a child driving my bicycle down McCarty Road, and a truck came by with all kinds of stuff flying off of it, and within a couple of minutes I started breaking out in hives all over my body, and to this day I don't know what it was I was exposed to, but it certainly was something that was, somebody else must have been exposed to. So we have lots of pollutants, contaminants in our area that are handled by various parties, refineries, chemical plants, trucks, railroads, and so forth. And so it's good for our citizens to be aware of what the risks are and what kind of monitoring is being done by various agencies, what the response is, and particularly what kind of effects it might have on your health, your family, as well as our environment. What we're going to do tonight is we're going to have about 15 minutes for each speaker, and we have a nice lady up here, Samantha, who will be waving the 1 minute flag. And so try to wrap 5 minutes. Oh. 5, 3, 1. Oh, okay, very nice. So you have no excuses. So every once in a while, I'll look at her. And we're going to start. Our list of speakers includes first speaker, which is Dr. Latrice Pavan, who is very well known in our area for her work in public health. She is currently the Harris County Pollution Control Services Department and she serves as interim director for that department. And with that, I would like for her, also, by the way, you should have the bios of all our speakers tonight, if you'd like to know more about them, because they have lots of experience in this area, and we're very fortunate to have them working for us as public servants and also with our nonprofits and so forth. So, Latrice.
Good evening. So I was asked to come today. Can you hear me? Yes. I was asked to come today to speak a little bit about, first of all, what it is that we at Pollution Control do, and then secondly, to discuss some aspects of the ITC incident and the barge collision that occurred. So we're going to get started. Oh, that's right. So, what is Harris County Pollution Control? Harris County Pollution Control is a regulatory entity that has been actually in effect since 1953. We were established to basically come into the Harris County area through the health department. We were part of the health department back then to help clean up some of the water and pollution issues that we were experiencing in Harris County. We investigate citizen-initiated complaints. So basically, U.S. citizens are our eyes and ears. If there's something that you see, you give us a call and give us a heads up as to what's going on. It could be something like industry is polluting. They may be having a flare that you want to know what's going on. There's a smoke coming off there that's yellow. You want to know what's going on. Or it could be you smell something that's causing your nose to burn, your eyes are burning, something like that. Those are good indications to us that there may be something that we need to bring certain instrumentation out there to do air monitoring. It could be something like you see a discharge in a receiving stream, or even if it's your neighbor that is burning something or they're doing something around their house that's killing trees and you're concerned about what that might be doing to the environment, give us a call and we'll come out and start an investigation. We routinely sample municipal and industrial discharges for their effluent. So there are some 400 plus municipal outfalls at the wastewater treatment plants that we routinely sample, as well as all of the industrial outfalls in the area. We respond to hazardous materials emergencies in Harris County, and we evaluate the impact on the public and the environment. So it could be something like a truck rolled over, there's diesel that's spilled, hazmat may go out, but we also go out to investigate that and make sure that the cleanup is done by the responsible parties. They hire a contractor. We don't do the cleanup, but we make sure that they hire a contractor to do the cleanup, and then we go back and make sure that it's cleaned up and remediated, and we make sure that the person that is responsible is held accountable for that. Also, in the event of a major event like an air release or something, hazmat may go out, but we also go out in coordination with them to accompany and to provide air monitoring. We evaluate the compliance of facilities regulated within Harris County. So all of the facilities, like I said, we inspect them, and we also pull effluent from their discharges. Say there's a facility that has repeat occurrences. It could be a small facility, it could be an industrial, chemical, petrochemical entity, or it could be a wastewater treatment facility. We have a compliance section that looks at that to see how often they have had violations, and if they are egregious, then, or if they are multiple and repetitive, then we also refer those cases to the county attorney's office. If they are of a criminal intent, meaning that they willingly and they knowingly did it. So often those are things that, so we may explain to someone they can't burn, or they burn and we've explained the rules to them and they repeatedly go ahead and decide to burn, then that could be considered a criminal offense if it's repetitive, and it could go to the district attorney's office. We also know that there are a couple of cases that the district attorney is moving forward on, pretty new, but they're moving forward on some of those as criminal cases from industrial facilities. So lastly, I'd like to say, we also support the Harris County Legislative Platform and proposals, and we provide comments on bills. So the 86th legislative session just ended, and we participated in providing comments on a lot of those bills that were environmentally influenced. So what you see here is related to the ITC incident. This is, pardon me, it's not a very clear picture, and I apologize that it didn't come out as clear as I would like it to. But what they are points of our sampling when we went out on the actual surface water and collected samples to see exactly what was being discharged from the ITC incident from that break in the berm area that caused that discharge to go into Tucker Bayou and eventually into the Houston Ship Channel. So we went out and we wanted to sample at some various locations. So if you look, we sampled here as well as up in this area because we wanted to see from the tidal influence if there was going to be any impact that came down and maybe made its way out closer to Galveston Bay. What we really found was of concern was the PFAS. We found some PFAS in some areas, and so we went up a little north towards Lake Houston to get a background sample. Now, PFAS is an emerging toxin. It's found in things like your wrappers for your hamburgers. It's found in some of your plastics that your microwavable dishes are in. But in this instance, it's found in the firefighting foam. And so we wanted to see if there was any impact from the firefighting foam. We knew that they had to use the foam because they had to suppress the fire. And additionally, the firefighting foam was to keep some of those benzene vapors from emerging and coming out. When it was disturbed, then we had some peaks and some VOC readings, but when it was in place, we didn't see that. So we knew they needed to use it, but when it flushed out, when the berm broke and that flushed out, we wanted to see what that might have done to the receiving streams. Well, basically, there were some levels that were found, but for the surface water, the EPA did not have an established level for us to compare to determine at what level we would see health impacts. There is a level for drinking water that the EPA has established, but because we don't drink the surface water in the Houston Ship Channel, those were apples to oranges kind of comparisons, and we couldn't make that comparison. So I'm sure you've heard that there was a lot of sampling going on during the ITC event. There was a plume that stretched into West Houston, to the west side of the county. So we wanted to see every area that we could sample where maybe the plume loomed over if there had been an impact. So we did park sampling for soil. We also, if the park had a water body, we sampled the surface water from we didn't go into boats and sample from the middle of the water, but we did do a sample near the shore, and then we also did a near shore sediment sample. What we learned was that there was really not there was not an impact that was above what was considered the rebels or the Texas terps. It did not exceed those health benchmarks. We were not able to do deep sediment sampling in some of those areas just because we did not have access to boats to get out into those receiving streams. And I will say, in those samples, we also did PFAS, so that emerging toxin. There was no level of the PFAS that exceeded any, even the drinking water standard in that. Even though you don't drink the water that is in those parks, we didn't see anything that exceeded the drinking water standard. So this This is the last slide that I have, and it's just kind of a brief picture of what we did as air sampling for the barge collision. Now, this was a little bit of a different event for us because the barge collision happened within the maritime waters, and it was not in Harris County. It basically occurred in Galveston County, but it came over as an air contaminant into Harris County, so that's why we were involved and we did some air monitoring. There are several locations that you'll see. I don't know if you can see the numbers. Oh, sorry. I don't know if you can see the numbers, but say this number here, it's 20.3. Well, that number is actually a total VOC number. It's not a benzene number. For the benzene numbers had to be pulled on a different type of a tube. It wasn't taken directly. Once we got a hit on VOC, then we pulled out a tube and we determined whether or not there was benzene associated with that number. What we determined was that even, thank you, sure. In those, even when there were VOC hits as high as 38.3, we did not detect, Harris County's sampling did not detect any level of benzene that was detectable in the tubes that we utilized. I am aware that there was a benzene hit. It was, if I'm not mistaken, a little west of this number that we detected at 44.5, a little west over in this location here. However, all of our numbers tracked pretty closely, and we never did detect a benzene hit. So I'm not really sure what the source of that was. We do know that there was a benzene detection, but the records that we had did not show any benzene detection. So I have a few questions that were given to me for this discussion, and I would like to give you a little bit of information. So if you have your pens, to get you a little more information about the barge collision. There was a website that was established by the Incident Command. It was bayport-response.com. There's information from every day that they were out there. All of the agencies, all of the agencies that were out there were reporting to Incident Command, and their air monitoring that they collected was out there. Harris County Pollution Control only was out monitoring on this event for, I think it was the first and the second day. Once we determined that we were not getting any benzene hits, we referred over to Incident Command, and they continued the air monitoring. So back to I did not bring a slide. I apologize that I did not bring a slide that showed the plume, but what I did want to say was that the plume did go a little bit toward the west trajectory, and so in doing so, there was an aspect flight that happened pretty much every day for the duration of this event. I was asked why the aspect flight that the EPA did not detect any benzene when we knew that there were some benzene hits out there. Apparently, when the aspect flight was being flown over, the information that was being generated did not include benzene because the flight pattern did not include benzene as one of the parameters that they were searching for. So even though we knew that there were some detections of benzene that people were getting on ground level, there was no benzene detections in the aspect flight because of that reason. One of the other questions that I was asked about the PFAS, I mentioned that PFAS was found, and I did fail to tell you that the drinking water standard for PFAS was 70 parts per billion. So in drinking water, the EPA has established that it is safe for you to drink 70 parts per billion, which is a very, I don't know exactly what it is in your wrappers, but there is the standard for the drinking water is 70 parts per billion. Some of the numbers that we saw in the surface water were 149. Nothing was over a 500 ppm or ppb threshold. So again, even though it's not related to a drinking water standard, they were very, very close to those numbers in the hundreds and 200s. And so I just wanted to let you know that, thank you. Just wanted to let you know that even though we did see that there, it was not of something that the EPA established as a level of concern. My time is up, thank you. Oh, I'm sorry, this is the website that I mentioned for the barge collision. Bayport Sites.
Thank you, Latrice. We'll hold questions for the end after all the panelists have given their presentation. Our next speaker is Lucy Randall, who is a board member of the Air Alliance Houston organization. And Lucy has been involved with, is a chemical and environmental engineering professional with experience in government, industrial, and nonprofit sectors. During the recent ITC tank fire in Deer Park, she provided technical support to Air Alliance Houston in interpreting the air monitoring data provided by local officials. And with that, I'd like to welcome Lucy. One thing I wanted to apologize to all the panelists. I understand they've been having difficulties with the projector. They did a good job of making up some good slides, but it's all the projectors, I understand. So don't get scared when you look at your slides and go, oh my God, you didn't do anything wrong.
Good evening. I'm with Air Alliance Houston, and we work to improve Houston's air quality through research, education, and advocacy, long-term, and then when we have incidents come up and emergencies, then we try to mobilize our staff and our volunteers to get the information out to the public and to supplement whatever is coming out from official entities. Tonight I'm going to talk about tracking emissions from emergency releases. I'm going to use the recent example of the ITC fire to discuss the process of air monitoring and reporting of hazards from emergency releases. There are a lot of different kinds of monitoring. We heard about a lot of things already from Latrice's presentation. I'm going to try and go through what exactly they're doing and why, to hopefully make the whole process make more sense, so that when you get that information, you can interpret it and understand if you're getting the information that you need. This slide shows toxic combustion products. So when you're going to be monitoring something, you need to know what you're looking for. In this case, we had a fire at a petrochemical transfer terminal. So we had oil and petroleum, the last line on there. And so the zone 1 is the source where the incident is occurring. Zone 2 is the surrounding area. And so in this case, we see that the chemicals that we're looking at that are most likely to be in high concentrations are particulate matter and organic irritants. The acrolein, formaldehyde, And those are the things that are most likely to cause the acute effects, things that you're going to be noticing right away. If there's benzene and that kind of thing in the air, those are more likely to cause chronic effects. You're probably not going to notice immediately benzene effects unless it's very, very high levels. We can move to the next one. Okay. So the last slide was about what you're going to get for pretty much all fires, whether it's, and that's just combustion. And when you have combustion, in this case, it was very hot combustion because petroleum and it was open. So the combustion was pretty efficient. But you still need to know what's in those tanks and what's burning, because as we saw at some points, the combustion stopped and then all the stuff in the tanks was leaking out. So what was in the tanks? We had naphtha, which is light hydrocarbons and aromatics. That's where it started, and then it spread to xylene and toluene tanks, which are aromatic compounds, and pyrolysis gasoline. So pyrolysis gasoline, as you can see, has a very high concentration of benzene. And once that got involved, that was when we really started seeing the benzene spikes. And that didn't burn completely, so there was still product left in that tank when they were trying to control the fire. And as she was talking about, that they put the foam on top to try and suppress the emissions. So now we see what are the things that we're looking for, and that will help inform our monitoring plan, because you don't want to just go like, oh, well, let's just go take some samples. We want to be focused and be looking for something specific. Yeah, thank you. Okay, so then we have our monitoring tools. We have stationary monitors, mobile monitors, airborne monitors. There are many different ways to monitor. The stationary monitors include the TCEQ network, the facility fence line monitors, and even some citizen networks. Some of them are more available than others. The TCEQ monitors should be available 24 hours, 7 days a week. Sometimes, as even happened during this incident, they go down for maintenance. And often you have to wait 3 hours for them to do quality control and validate the data. So you don't necessarily have that data real time. The nonprofit networks may not have the quality control, but you're more likely to get them sooner. The ground level monitoring will be typically handheld apparatus that you bring into the plant. It's often the first line of response at the facility itself, where they're trying to figure out, do we have something that's going to blow up? What kind of emergency protection do we need for our people and for our firefighters? And do we need to evacuate the plant, the community? So those are screening monitors, and they're not necessarily going to give you all the details of the speciation and the exact compound right away. You might get them later, and that's where you get things like the mobile vans, which drive around the neighborhood. The city of Houston has something called the MAMA. I have it written down here someplace. And the TAGA is the EPA Trace Atmospheric Gas Analyzer. So those will drive around the neighborhood when they find a specific area. And they have gas chromatograph, which is also available at several of the TCEQ monitors. And they may take a grab sample in a bag and then take that and run it into their monitors. And so then they can get into a little bit more data. And the flyovers, Latrice mentioned this, the aspect, and the aspect is the, let's see, I got the official name for it, is the Airborne Spectral Photometric Environmental Collection Technology. So the thing with the aspect, these are planes that the EPA has, and they are ready to be up in the air within an hour of being requested. And so again, they are a screening tool. They are going to come as fast as they can get there and go up in the air, and what they're doing in this case is they're looking for the plume. Where is it going? What is the meteorology? Can we detect some of the contaminants? We might not detect all of them, but maybe we can detect something, because they have certain photometric technology that does not work on every compound. Next one. Okay. So here we're looking at the here we are looking at particulate monitors in the stationary monitors. So the TCEQ, as you can see, has about 6 monitors, and they're all pretty much along the I-45 corridor. Now, I don't know about you, but I know people all over town who are saying, well, the smoke is bothering me, I'm coughing, it's burning my eyes. I live on the west side of town, and my neighbors were, commenting to me in Facebook, like, what's going on, what's going on? Because they could sense it, but they were getting the message, well, everything's fine. And so there was a lot of confusion. So when you're setting up a monitoring plan, the messaging is very important, because people have some data and you're giving them some data, but then they have their own experiences. Okay, you're telling me everything's fine, but I'm coughing and my eyes are burning. That's not fine to me. So one thing we have here, it's really not a very good slide, but the Purple Air is a citizens network, and they have monitors placed all over the world by citizens and schools and different groups. Airlines Houston has placed several in neighborhoods around town, and during the fire they actually placed additional ones on the west side of town, because that's where the plume was heading in the early days. And the TCEQ monitor is measuring, this was just a couple of days ago, is measuring in micrograms per meter cubed. And the Purple Air that I have set here is measuring the air quality index, which converts the micrograms per meter cubed to a scale where 100 is like the regulatory limit, and that's yellow, and green is lower than that. That's everybody's happy, it's green. And so that data is available immediately. And people are looking around town saying, oh, look, there's high particulate matter, so maybe I should be careful. Okay, so here is, for the first week of the ITC fire, is a chart of the particulate matter data. So the bar there is what is equivalent to 100 on the AQA. That's 35 micrograms per meter cubed. For comparison, I'm going to jump ahead. Okay, so this is, I told you how people go into the plant immediately with their handheld monitors. Well, ITC contracted a company called CTEH to do their monitoring. And we saw a lot of these charts, which you can't really see here, but basically it shows a lot of green dots that says everything is great. And if you look a little bit closer and you actually look at their reports, you see that their green dots are not the same detection limits that you're used to seeing. For example, the PM 2.5 action level is based on a 1-hour wildfire standard of 138 micrograms per meter cubed. Now, we just said that our air quality index of 100 is 35 micrograms per meter cubed, and that's the 24-hour standard. So they're measuring an acute action level, and same with the benzene. Their action level is 2250 ppb. The TCEQ action level for 24-hour exposure was 180 ppb. So this kind of thing is kind of confusing when you have these companies reporting out that their data are showing that everything is safe, then it's not necessarily safe, but there's a difference between the levels being safe and the levels meaning that you need to evacuate and you're going to die. There's a whole lot in between. And I think that's really the message that was not conveyed through all the presentations by the county and the city, and anybody who got up there and was talking about how, well, don't worry, it's okay. Well, no, it's not okay, but it's not going to kill you instantly. So it means be aware and be cautious and take precautions. And so that's where learning to interpret the data and understand it really can make a difference. Now I want to go back to the aspect. I don't know why it's really hard to read this, so I'm just going to tell you what it says. So Latrice mentioned that the aspect data wasn't picking up benzene. So they fly over in the airplane and they have a photometric meter, it uses infrared technology. And benzene and aromatic compounds and straight chain hydrocarbons, which were the main things released at ITC, show up at the same wavelength on their monitor as water. And you have a lot of water in fire. So you cannot detect it. So the spectral data was good for telling you where the plume was and what the meteorology was. It told you nothing about what was in it. And so again, you need to understand there are different things and they have different purposes. This was a useful tool. It told them where the plume was going. It told them how high it was. And it did pick up some compounds, some branched hydrocarbons, and they were not at very high levels. But it did not tell you if there was benzene in the plume. They could not measure that. They did not have the tools for that. So there's a lot of data. It's kind of like monitoring soup. I kind of say like your stationary monitors are like your stock. That's what you start with. That's what you got all the time. And then you add in some of your main ingredients. Well, you know, with a fire, you're going to have fire has particulate matter. So you know you're going to want to mobilize your particulate readings right away. And then you add in your special things that are particular to this individual soup. And that's the benzene monitoring, and that's tracking exactly where it's going and figuring out how you stir it all up and what comes out. And so from the monitoring soup, you figure out what you've got and you track your emissions, and hopefully next time we'll get a better job at communicating information so that the public actually understands what the risk is, that it's not oversimplified so that people are thinking that it's all great, but that it's also not to the point where they're feared for their life when, no, there are things that you can do to maintain control. Thank you.
Thank you. Our next presentation is going to be a tag team presentation. Our speakers are Ms. Sarah Gossett Robinson. She is a water programs manager at the Galveston Bay Foundation, and she's involved in water quality assessment and monitoring, and works as a citizens group that does a lot of work here in Galveston Bay. She will be assisted by Mr. Nicholas Ellis, who is also working in that program and is also pursuing his master's in environmental science at the University of Houston Clear Lake. And with that, I will turn it over to Sarah.
Thank you, Dr. All right, thank you all for coming here today. As Dr. Guillen mentioned, I am Sarah Gossett Robinson, and this is my colleague Nick Ellis. We are with the Galveston Bay Foundation, and we'll be talking a little bit today about the work that we have done monitoring and sharing information around both the ITC fire as well as the Bayport collision. So the Galveston Bay Foundation, we are a nonprofit organization that works to protect and preserve Galveston Bay, both for today as well as for future generations. So when we see instances such as this chemical fire at ITC, or barges colliding within the Houston Ship Channel that are happening on Galveston Bay, of course we start to worry pretty quickly on the impacts that this might have on the bay, both in terms of the wildlife that live in the bay and rely on the bay, as well as all of us who also enjoy the bay, live on the bay, work on the bay, and rely on those resources. And so when we start to see images such as this firefighting foam that is being run off directly into Tucker Bayou, ultimately flowing into the Houston Ship Channel and Galveston Bay, we really start to wonder what type of impacts are this going to have on the bay? What type of contaminants and pollutants are being put into the waters? And we knew that when this incident was occurring, that there were professional monitoring professional monitors out there collecting water samples to gauge the impact of water quality on Galveston Bay. But we really were not able to find out much information on what was being monitored and where it was being monitored. And so in that, we saw a need to make sure that there was an effective amount of monitoring being done for the right contaminants in the right places. And so we ended up partnering with Environmental Defense Fund, who you'll hear from in a little bit, as well as Texas A&M University to start collecting water samples around Galveston Bay to better gauge the potential impacts from the ITC fire, both looking at the impacts from the fire itself as well as the runoff from the firefighting foam that we've heard about already. So our ultimate goals with this testing was not only to understand the impacts of these types of incidents on Galveston Bay, but also to share the information that we were gathering with the public, to be as transparent as possible, both within the sampling that we were doing ourselves, as well as with any other information that we were able to gather as well. So we created a map on our website that we'll show in a little bit that really highlights and includes all of the data that we were collecting while we were out doing our sampling. And then we also worked to use our social media and our voice within the community to share information on seafood consumption advisories, on shelter-in-place advisories that were happening within the community.
Okay, and just to give you a little idea of where our sampling efforts took place, on March 22nd, we hit the Ship Channel for the first time, and these are the 5 sites we hit. We hit Beltway 8, 1 mile upstream from the incident, right here at Tucker Bayou where the ITC incident occurred, a mile downstream down here at the Battleship Texas, and then over here on the monument. In March, we did the Ship Channel run once, and then we hit our Shoreline Sites twice, and the same thing in April. This one shows our shoreline sites that we hit. We have 6 sites that we chose based on likelihood of contact recreation. There's a lot of fishermen in these areas. So we have River Terrace Park, Lynchburg Ferry, Baytown Nature Center, Morgan's Point, Strang Road, and then the Santa Ana Monument over here. And again, we hit, in March and April, we hit both at the Ship Channel once and all the shoreline sites twice apiece. And then after April, we decided to pick up continuous monitoring, and we just hit the Ship Channel again 2 weeks ago.
All right, so as I mentioned, we really wanted to make sure that we were sharing our work with the community and making sure that the communities in our area were aware of this incident and the potential impacts that were being monitored. So we really relied on the media as a partner in these efforts, in sharing the type of monitoring that was occurring, the resources that were available, and providing them with more information for us. And with this, we were really able to partner with the media and use them as an ability to strengthen our voice even more.
And we won't go over all of our results tonight, but we do have our results online. We have a map set up on our website. And this is just an example of one of the sites. Saturday, March 23rd, we had our highest hit for benzene, and that was at the Lynchburg Ferry. The day before, when we were sampling at Tucker Bayou, that berm actually breached while we were right there sampling at the boom in front of it. So it was good timing on that sample right there. And then the following day was when we had the highest benzene rating over here at Lynchburg Ferry, and all of this one was above the EPA's recommended water criteria for benzene, but well below the TCEQ state standard, and none of the others exceeded that value right there.
And this was benzene in the water. So the map itself highlights all of the volatile organic compounds that we were monitoring for in the water, which would be associated with the actual fire itself. But I mentioned that we were also looking at the impacts on the firefighting foam. And so with that, we also were testing for PFAs or PFAS that Dr. Pavan was speaking to earlier. As Dr. Pavan was mentioning, these are a chemical compound or a group of chemical compounds that are found throughout a lot of industrial uses and in a lot of man-made products. But they are known to be within firefighting foam. And of particular concern, the two most well-researched compounds within this group of compounds, PFOAs and PFAs, are known to be in firefighting foam, especially firefighting foam that was created or manufactured more than 5 to 10 years ago. In fact, these compounds are known to be so harmful that they're actually banned from manufacture today, but they are still in distribution. And so we wanted to make sure that we were testing for these compounds and actually did find them present within the water. One of the challenges with PFAS, as Dr. Pavan mentioned, they are a contaminant of emerging concern. And so there is still a lot of research that needs to be done on the potential harm of these compounds, but they are known to harm human health, and there are currently no federal or state standards for these compounds. The Environmental Protection Agency has released an advisory for drinking water, and using that advisory, we can interpret what the risk of exposure might be if you were to be ingesting the water within Galveston Bay. But also of concern is the accumulation that this compound might have in our seafood. These compounds are known as forever chemicals because they do not break down, they do not disappear, and they are soluble in water, so they don't even settle down into the sediment. And with that, we know that they have a high likelihood of accumulating within our seafood and sticking around our waterways. As I mentioned, we did find PFAS present in the water, but because there are no standards in place, there's very little monitoring and testing that actually occurs for these compounds. So we cannot definitively say that these levels were not in existence before the ITC fire happened. We did actually see an increase in PFAS levels after the berm broke. A week later we went out and we saw those levels increase, which is a good indicator that this incident did release PFAS into the environment. But what this really speaks to is a need for ongoing testing and monitoring of these types of emergent contaminants. We know that there are contaminants that we are creating and pollutants that we are putting into our environment that are not being tested for. And we need to be doing a better job of identifying those contaminants and testing for those contaminants and advocating to our regulators to create standards ahead of the curve instead of waiting until we have a plethora of instances like this and severe harm to our health to actually respond. And then just really quickly, kind of going into the Bayport collision, which happened pretty soon on the tail end of ITC. So at this point, we are still out in the water collecting samples for ITC. And so our initial thought with Bayport was, do we need to be doing water testing for this incident as well? And within hours of this collision happening, we were in communication with incident response. They were incredibly transparent in the type of work that they were doing to better understand the impacts of this, and then also to contain the contaminants around this berm as well. So we actually went out the morning of May 11th to start collecting water samples and met up with the incident response group who was out there collecting their own water samples. They were able to share with us their sampling plan, what they were collecting samples for, where they were going. And so we really realized that they were doing a great job themselves, and we really didn't need to necessarily duplicate their efforts. So instead, we really focused on becoming part of incident response, and we were actually invited to become a part of the Natural Resources Committee of their incident response for this program, or for this incident. Our property on Kima, just off of 146, was directly impacted by this collision. Not only were we getting sheen washing up on our property, but we also had thousands of dead fish. A lot of juvenile fish, but also some crabs and larger adult fish as well wash up on our shoreline. And so we were very actively involved in the damage natural resource assessments that were taking place and in the remediation and cleanup efforts that were happening around our property as well. And those are still going on today. So just kind of some best practices that we've taken away from this and that we've tried to utilize through these incidents. First and foremost is transparency. If everybody was completely upfront and transparent with the information that they were finding and the gaps and the holes in their knowledge, we would feel a lot more comfortable that enough was being done to help address these issues. And so we really tried to be that voice of transparency, just to share the work that we were doing and also be that bridge between the incident response and the communities themselves to provide the proper information. And then also to work with all parties involved in the incident. Kirby, who was operating the barge that was part of the collision, was very much involved and has been very much involved in the cleanup efforts and in working with us to make sure that they are creating as little of an impact as they possibly can. And that definitely helped a lot in getting us into the room and to be a part of some productive conversations. And then, of course, to also conduct our own independent sampling. Nick likes to say there's no such thing as too much data, and there's almost always a gap that can be filled. Airlines Houston, Lucy was talking about that need earlier, and so really identifying those gaps and what questions still need to be answered. And then constantly, as I mentioned at the beginning, just continue to have an open line of communication. And with that, I will turn it over to our next speaker. Thank you all very much.
Thank you. Our next speaker is is Miss Katie Moore, and she is with the Environmental Defense Fund. She has led hyper-local air quality mapping with Google Street View cars in Houston and in London, and has overseen deployment of a network of stationary air quality monitors and has worked on bringing mobile air quality mapping to scale in a pilot program here in the city of Houston. And with that, we'll turn it over to her, but first I want to make one announcement. There's 2 sets of Toyota keys at the sign-in table. There we go. So, Katie?
Hey, so I'm Katie Moore with Environmental Defense Fund, and Doug asked me to talk a little bit about the air quality impacts of some of the recent industrial accidents and about the health effects. Let's see. So, I mean, I just wanted to first say that it's been kind of a harrowing couple of months in terms of air quality accidents, as I'm sure, I mean, you all know because you're here. But between fires in Baytown, ITC, Chemco explosion, barge collision, it felt like one thing after another. These really high profile, really terrifying air quality accidents. But I did just also want to say that these kinds of accidents are actually not that uncommon in this region. They're not always as visible. They don't always have a big plume of smoke. They're not always even detected or reported accurately, but they really happen all the time, which is, I think, the underlying sort of issue here. And so I'm just going to start with an overview of both the ITC fire and the barge accident. I think I might be repeating what a couple of folks have said, so I'll try not to do that too much. But the ITC fire started on Sunday, March 24th, when a fire caught at a storage tank facility, the Intercontinental Terminals Company, which is, as other folks have said, a facility that has just a number of tanks all in a row that stores different petrochemical compounds, things that are mixed or byproducts in the oil refining process. The fire burned for more than 60 hours. Once these things sort of start, it's just a big tank of gasoline, so you can imagine it's incredibly hard to put out. And as I'm sure you all know, it forced school closures, several shelter-in-place events, which is when you're ordered to stay inside your home and seal up any opening to your home with plastic sheeting and tape, which are really sort of only happen in very extreme circumstances. Several were ordered for the community around ITC, and even more for some of the industrial facilities nearby for their workers. The Harris County Public Health initiated some of their mobile health units, and over 1,000 people sought treatment for fire-related ailments. Just really an incredible number. And so I think you all have seen something similar on Lucy's slides, but this is just an overview of the tanks from above, and hopefully you can read that. But what was stored within the tank is written on the top, and then there's a key down at the bottom that explains sort of what the involvement in the fire was. So there was this drum here, which was filled with naphtha, was the origin of the fire. Anything that's in red, so these three here, base oil and 2 pie gas tanks, were burned out. It shows up in kind of white here, collapsed as a part of the fire, and then these 4 here were on fire as well. And any that are in this sort of green color were not burned or impacted by the fire. And others have touched on this too, but I just wanted to make the point that there were kind of 2 phases of air quality impacts of this event. So when the tanks were on fire and there was combustion of the material and we saw the big plume, that was sort of phase 1. And in that phase, the material is burning, you're seeing a lot of soot, you're seeing this dark plume, and actually we saw, I forget who showed it first, but we saw the particulate matter levels, which is what we would be probably most concerned about in that instance. And they were higher than we typically see, but they weren't insanely high. And that was largely because the plume itself was actually being carried up and over. And so we were seeing some elevations at ground level, but the weather was such that the atmosphere was not sort of trapping that plume very close to the ground, which is, just sort of dumb atmospheric luck on the part of all of us. Otherwise, if that boundary layer had been lower, then we would have seen higher concentrations of particulate matter closer to the surface. But then, as others have said, I think that the greater air quality concern happened after the fire was put out. And so you have all of these tanks of material that is used in oil refining. It's all very flammable, and it's all very volatile, meaning that all of those materials are in liquid phase, but they really would like to be in the air. And that's why we keep them in tanks and cover them, because without that cover, that material will all just vaporize into the air. And so actually, once the fire was put out, was when we started to see really, really high levels of benzene, because there was nothing covering those tanks. The layer of foam was put down to try to prevent that vapor from rising and impacting the nearby communities. But as others have said, there was sort of in the days when they were cleaning out the rest of the tanks, there were several failures of that foam, and we saw these really, really high spikes of benzene and other VOCs. And so this is a map of some of the air quality monitoring that happened during the ITC fire, done both by Harris County and by City of Houston, as well as Texas National Guard. And it's a little hard to see, but I just want to point out the units that we're looking at here. So for these dots, these sort of green circles, this is anything under 0.499 part per million of benzene, which is 499 part per billion. And then there's one reading right by the fire itself that Harris County took that was greater than 500 part per billion. And the other units on these other symbols are the same. This is just an image of the fire here. And let's see, I'm actually going to go a little bit out of order. Because I'm talking about benzene and the levels, I want to give a little bit of information about the health effects and kind of different standards for benzene, because I think it's important to keep in mind as we're talking. So benzene is something that, from the public health community standpoint, we're incredibly concerned about. It's a component of crude oil, so it's involved in the oil refining process. It's found in oil and gas that you would put into your car. And there's kind of two different, it has both acute symptoms as well as chronic or long-term symptoms of exposure. The acute symptoms, which is what is going to happen sort of in the short term, typically happen at very high exposures, and it's like a lot of other VOCs, it's impacting your nervous system, so it causes things like drowsiness, dizziness, confusion, some other symptoms that are sort of typical of that kind of VOC exposure. The longer term health effects, greater than a year, are really pretty serious. So it's linked to harmful effects on bone marrow. There have been some animal studies that have linked it to low birth weight, and it's very definitively linked to leukemia. It's a carcinogen. And I just wanted to note here that typically within public health, health effects are really estimated at a population level. So we're looking at everyone within a community. It's very difficult and really not possible to be able to say what an individual exposure or even a series of exposures will do to an individual. All we can do is sort of say in the aggregate what exposures typically do. However, it is very commonly, it's very well known that there's really no safe level of benzene exposure, despite a lot of industry sort of pseudoscience to try to say that there is. It's one of these pollutants like lead, like some others, where there's no lower limit below which we don't see health effects. We believe that it has health effects even at very, very low levels. So really the thing that we want to do is limit completely our exposure if we can. This is just, in American Petroleum Institute, which is a oil and gas industry trade group, said all the way in 1948 that there's really no safe concentration. And I want to talk a bit about standards as well, because I think what we were hearing a lot and what we hear often in these accidents is that we're not finding anything of concern. But there's not always a lot of clarity or even rational thought, I think, behind what that level is. And so just to highlight a couple of the standards here. So the Texas 1 hour threshold for benzene, and sorry, I should step back, but thresholds are usually set at an average concentration over a period of time. So the Texas standard for 1 hour of exposure is 180 part per billion. And Texas is pretty infamous for having really high standards, too high, in my opinion, and a lot of people's opinion within the public health world. And so to contrast with that, the California standard for a 6 hour exposure is 8 part per billion. So much lower. So this just gives you a sense of kind of the realm of what we might be thinking about as safe or not safe. And then to go back to a couple of our, to ITC and the barge accident, So after ITC, we did some monitoring with some equipment that we've worked with previously after Harvey, and found concentrations in single samples. So we're typically measuring over a couple of minutes, right? So we're not measuring an entire hour. But we found concentrations as high as 495 part per billion after ITC, and EPA and TCEQ, when they were measuring, also found concentrations above 500 part per billion. So much, much higher than some of these, than even the Texas standard, which we know is really too high. And after the barge accident, I'll go back and talk a little bit about this, but a TCEQ contractor found levels of benzene within Seabrook that should say 2,400 to 2,600 part per billion, which is just astronomically high. I mean, I just can't say it more firmly that it's just incredibly high. It's much, much, much too high. But sort of the kind of working definition that seems to be emerging in all of these events is that Unified Command is typically using a 1 part per million or 1,000 part per billion threshold to define their action level. So they're saying below that, we're going to say that it's okay, and above that is when we start to get concerned. Which is, in my opinion, I think is inappropriate, because that is, it's a workplace standard, which means an 8-hour exposure. But workplace standards are one, pretty notoriously high. They're also set for healthy workers, and they're also set assuming that there's an 8-hour exposure that ends when that worker leaves and goes home. So they're really not appropriate for community settings. They're not appropriate for kind of the diversity of populations within a community, for children, for the elderly, for expectant mothers. But that's sort of what has been settled on. I'll just go back quickly to just a few bullets on the ship channel, on the barge collision. Over 9,000 barrels, which is about a little less than 38,000 gallons of oil spilled. And the official line, again, was that there was no threat to air quality. However, on the 10th, a TCEQ contractor found this really incredibly high spike of benzene in Seabrook. And there was also just a real breakdown in communication. So Unified Command was not notified for 2 hours, and then there was no public notification for more than 15. So let's see, I think I'm gonna wrap up. I threw this slide in here. This is with some work done by our colleagues at Environmental Integrity Project and Environment Texas, that found that Texas imposed penalties only on 3% of emissions violations reported. And I just threw this in here to say that these accidents are incredibly common within Texas, within this area, but they don't have to be. The state has really allowed this to happen by being sort of incredibly lax on the accidents previously. There's truly no incentive for a lot of these facilities to do any better, and so they don't, because it would cost them money to. And it does not cost them very much money to continue to violate. We saw that with ITC, we saw that with Chemco, that there were just huge, incredible sort of repeated histories of violation. Let's see, so I just wanted to run through a couple of things that we're really sort of working on and pushing to help improve, and that we're hoping will sort of help improve and prevent these accidents in the future. Obviously, enhanced enforcement is key to prevent these accidents from happening in the first place. That's sort of the top. That's what we need to be doing the most of. But we also need enhanced monitoring. There's after all of these accidents, we've seen sort of a scramble, and we've seen a lot of agencies step up and try to do better, but the infrastructure is really not in place to be able to understand the threat of these accidents as it's happening and to be able to communicate that information to the public. I'll sort of stop there, but just to say as well, I think there's an incredible need for transparency and for community notification during these accidents, which we did not see. It was very unclear what standards were being used, what the information was, and oftentimes that information lagged by hours or almost days before it got to the community. So I'll stop there.
Thanks, Katie.
per barrels should have been 378,000, not 37,000.
Oh,
I think
I'm
that's
so sorry.
so important,
Yes,
because people need to understand how many gallons it was.
It's being reported in the news as 9,000 barrels, but I think it's very important that people understand it in a unit of measurement they understand. So I just wanted to make one correction to that slide.
Yes.
Thank you.
Yeah, you did a fabulous job, and we're like, no, 3 gallons.
378,000.
So it's 42 gallons in a barrel, yeah?
Correct.
Yeah. So sorry for my math
And it's
error.
actually 11,000.
Oh, okay, we'll just strike that.
Let's
So almost
continue
500,000,
discussion
yeah.
after, but thanks for pointing that out,
Sorry.
for clarifying that. Our next speaker is Melanie Oldham, and she is the Air Quality Chair of the Sierra Club Houston Group, and also she's affiliated with Citizens for Clean Air and Clean Water in Missouri County. She presently advises citizens in Freeport on Quintana Island on a variety of environmental issues affecting Brazoria County. And Melanie, she here? Oh, well, come on down. Thank you.
Good evening. I don't have a PowerPoint presentation, just bear with me as I go through my notes. I'm kind of low tech. But again, my name is Melanie Oldham, and I am from Freeport, Texas, which is an hour south of Houston, right on the coast. And Freeport is surrounded by Dow Chemical, BASF. We have Port Freeport. We have Freeport LNG being built on Quintana Island, 5 miles from where I live. And as I mentioned, I am with the on the XCOM of the Houston and the Austin Sierra Club, and I am on the Air Quality Committee for the Houston Sierra Club. But I'm mainly here because I'm a concerned citizen, just like all of you all. I moved to Freeport about 6 years ago, but I, for different reasons, had an interest because of my children, their asthma, in the correlation between pollution and our public health. So I started doing some research and learning, and in fact, I have a mentor, Sharon Stewart, who's here in the room, and she has mentored me and taught me so much through the years. And I also went to a lot of meetings like this, where I learned a lot of information and I learned to share it with other people. But my group I started in '06, Concerned Citizens for Clean Air, Clean Water in Brazoria County. Because I'm one of the leaders of that group, EPA, during Hurricane Harvey, they set up about 50 people who were, quote, leaders of environmental public health groups. And EPA we'd have phone calls twice a week at least. They give us updates, and so, which was really great. And then we could get out information to our groups or people we knew. So when the ITC fire happened, EPA continued sending us, in that group, about 50 of us, daily reports. The EPA Environmental Justice Department sent us, citizens and leaders of groups, these reports. So I know a lot of this. I'm just going to real quickly, I went back and looked at all the many emails that Gloria Vaughn with the EPA EJ department sent me. But just real quickly, again, as we know, on March 17th is when ITC at 10 a.m. discovered a tank fire. And then immediately EPA sent out their aspect plane, and they conducted air monitoring overflight in the downwind vicinity. EPA also conducted ground level air monitoring with handheld equipment, and they also utilized the TAGA self-contained mobile laboratory capable of real-time sampling of outdoor air emissions for continuous air monitoring in Deer Park, Texas. And then March 20th is when the fire was supposedly extinguished. At that time, EPA reported they had an environmental monitoring and sampling post, and that they were coordinating with the state, county, and Harris County, and local agencies. Then on March 21st in U.S. News, there was an article, "Residents Must Stay Indoors After the ITC Chemical Fire." Unfortunately, some people said that the local folks that were most affected maybe weren't notified. Then March 23rd, TCQ press release, they set up another temporary air monitoring station which registered high levels of benzene directly across the Houston ship channel, and at one reading was 207 parts per billion. Again, I'm not an engineer or a chemist or anything, but I know that anything over 108 parts per billion could affect our health in a negative way. So that was a very high reading. Then after the new fire was, and then the fire ignited again. After the new fire was extinguished, the EPA's Tega bus had readings of 1,000 parts per billion of benzene on the Peninsula Street near Buffalo Bayou. So like the other speakers were saying, there were some pretty high readings, even days after the actual event or fire. And then just on March 27th, the state of Texas, they filed a suit against ITC. But then on March 30th, more benzene detections, EPA monitoring data. They found 475 parts per billion near Channelview area from the Tega bus, which EPA had. On March 31st, there were some questions about whether a shelter in place should have been called, which wasn't. I don't know all the details about that. And then two more things. On April 26th, Commissioner Adrian Garcia asked Bob Allen with the Harris County Department what they lacked in manpower and equipment. So obviously, people realized that it was a learning experience and we need to do, better in some areas. And so I know it sounds like Harris County Department is taking a look at that. And then of course, around May 10th, they had the collision of the two barges in the ship, in the Bayport ship channel, which there was also high releases of benzene. So as a public health advocate, I Dow and other companies, that we really need to become involved, like all of you here, and understand that it can and will affect our health. Real quickly, one of the key things that I and Sharon have observed in our area is that the lack of monitors by TCQ. You would think in our area we'd have a lot of monitors. There's 100 something up here in Harris County area. We have 4 that are TCQ run, and Dow Chemical operates one of them in Lake Jackson, Texas. But I won't go into all the details, but we had for a long time, a historical air monitor for ozone and other things in Clute, Texas. And Sharon could tell you that we were there having highest readings probably in the state there at the ozone monitor in Clute. Long story short, in 2003, it was so high that they shut down the Clute monitor, and Dow volunteered to put in their own ozone monitor far west Lake Jackson, and of course the design value started dropping. But the point of all this is the key to us speaking up and asking that we have enough monitors, that the monitors are in the right location, and that if we don't monitor, how do we really know how bad the accident was and how will it affect our health? So monitoring is very important. I just real quickly, I was doing this last night, I wrote down some ways that we as citizens can protect our health when something like this happens, and unfortunately it probably will happen again in some of our areas. Simple things that I learned early on, like if there's an incident that happens or you're concerned, you can keep an odor health journal where you, right after the incident, you write like you have your eyes are watering, if you're sneezing, if you smell a funny odor like, a rotten egg smell. Anyway, that's real basic, but that's something we can do. Assist with monitoring emissions and demanding citizen-friendly data. Some of the groups here mentioned that they did some of their own monitoring, and that's great, and there's some organizations that will train citizens on how to assist with that type of monitoring. And we also need to insist that we have, that we are notified immediately after an accident or release, and updated public notification procedures. Again, this is, hopefully we learned some lessons from this, and I think from the groups that talked, we have learned lessons, and I think we've gotten the attention of some of the decision makers that hopefully will try to improve the process. And then we need to demand to TCQ and to our legislators to put more money in their budget for more air monitors, especially mobile monitors. When I found out a couple weeks ago I was going to speak, I called TCQ and I tried to get a hold of Mr. Chisholm with the monitoring division to ask questions about their budget for monitoring devices. And I never heard back, but today I didn't give up. I called, and the lady that is the assistant director of air monitoring for TCQ, she answered the phone. She was very friendly, answered my questions, and she said the good news is, and some of you probably already know, but the state legislature gave a one-time addition to their budget, $1 million, and TCQ is going to buy 3 new mobile monitoring vans. I was shocked to know that they only have 3 at this point. I guess for the whole state, one just measures weather, wind, that sort of thing, and only one, or I don't know if both could even, I think only one could have monitored the benzene. But they are, it got the attention of the legislature, so they did put, $1 million in. They said they probably, with all the paperwork, they won't be able to get these new mobile monitoring vans for about a year. And so again, as citizens, we need to talk to our legislators and demand that they ask TCQ to better protect the environment and our public health. And it pays that as citizens that we come to meetings like this and learn all that we can and get involved. And again, I'm just a concerned citizen like all of you, and I thank you all for being here, because we can take this information out to our friends and neighbors and hopefully make some positive changes. Thank you.
All right, our next speaker is Ms. Perla Treviso, and she's an environmental reporter with the Houston Chronicle, which means to me she must be extremely busy working in this area. But she has a very in-depth background working on a variety of topics, from county politics to higher education, both here in Texas and Tennessee, and has reported from a dozen countries. She's recognized for reporting. Ms. Perla has won state and national awards, and we're very happy that she's here to present her perspective on journalism.
Evening. It's actually good that I'm kind of towards the end, because I basically get all the information that they put out and then try to translate it for you. I've been in Houston for since April, so I'm relatively new from the area. I'm an El Paso native, but have been living outside of Texas for a while. And I came in at the perfect time, quote unquote. So when I got in, the Exxon had happened, the following day ITC had happened, a few weeks later Chemco happened, and then the ship collision happened. And then in the midst of all of that, there's been a lot of lawsuits filed, which means that I had to catch up with Arkema and previous Valero and previous cases. So when I first got here, I kept hearing from concerned citizens this whole issue with communication. People continue to feel that when an incident like this happened, they didn't know what was going on, the information was not relayed in a timely manner, they didn't trust the sources where the information was coming from, and this seemed to be a recurring issue. Every town hall meeting I attended, or just talking to groups, or just random citizens or residents. And so then I started reporting the story that we're going to listen to, a couple of clips right now, and talking to the city officials, the state lawmakers, and there seems to be a disconnect. So when you talk to the city of Pasadena, or when you talk to Harris County, they say the information is out there. And it's true, if you go to all the different websites, there are email alerts, there are text alerts, there's the readyharris.org website, there's Care Online, which is used by the industry to report incidents. But it seemed, after talking again to a lot of people, it seemed that the expectation was on the public to know how to tap into these resources. So you had to know where to sign up, you had to know where to look for this information, you had to learn how to interpret all the data that's out there. And as someone new to this kind of industry-related issues, you kind of need more than you just parsing the internet and kind of accessing the TCQ data. It is true that they posted, but what does it mean? Should I be worried? Should I not be worried? And I think what ITC proved and showed that the coordination that needs to happen with an incident like this is something like they hadn't had to deal with before. So if you live in Deer Park and your neighbor lived across the street but in another town, and one had to shelter in place but the other one didn't have to shelter in place, it was a lot of it to be expected from the public to understand that you were fine but your neighbor possibly wasn't fine, so they had to stay indoors. So I think there's a lot of changes that are coming after all these incidents. As I said, it's not that they hadn't happened to this degree before, but they haven't been as visible as they have now. And even though ITC, in terms of what was released and the potential danger, is not as harmful as some of the other ones could be, it was very visible for miles and miles and miles. And I think that brought it to the attention to not only the state level, but also the county. So there's a lot of things that they're trying to do to coordinate better. There's Harris County is going to try to put a lot more information on one website where you can just go there instead of having to visit all the different sites. There were talks in the legislature, which it seems that in the past 3 sessions there have been talks about how to do this better and more information, and not a lot came of it. I think a lot of it is still dependent on what the companies and the industry provides, which is another source of trust for residents. So for this story, I got the 911 calls to Deer Park for the first hour of the incident because they said they got so many calls that if I requested more than that, it would be very expensive to get them. But if you scroll down, I'll play a couple of audio clips that I included with you that just show kind of the confusion that ensued after an incident like this, and then I'll talk about another one that I was writing about today to show how it's not. So it's supposed to, yeah, the little play.
We are getting phone calls about the more basically this time that's been recorded to us from within inside one of the plants. Wow, okay. Okay. Which plant is it? I don't know what plant it is. TriMax is right next to it. What is it? It's a dumping yard, and then next to that is the TriMax. So it's between TriMax and where you are? Well, past us, it's next door to TriMax. Okay. Okay. All right, we'll get somebody to head that way to check it out, because at this point, you're the only thing that's given us anything with an exact location.
So this was about 11 minutes after the fire had broken, and it was a caller, basically someone who worked nearby, who was just saying, giving them the address for the first time. So this is the emergency personnel who didn't even know where the incident had happened. And then the next one is basically a woman says that she sees a plume of smoke and she's a concerned citizen.
Is Nancy? Hi, my name is Christina Wood. I live over here off of the East Boulevard, and I see like a large smoke cloud in the sky, and I don't know if I should be concerned or not, if it's in the neighborhood or something. Okay, we're aware of it. We currently don't have any information regarding it. Okay, okay, alrighty, thank you. Hey, this is Brandy. We've not gotten anything confirmed through our eMERGE systems as of yet, but we do know that from our fire chief and the emergency manager that there is a tank on fire at ITC, which is going to be at 1900 Independence Parkway.
And that's all we know. And they're fighting it on their own, I assume?
Yeah, they have not done a SEMA call out yet. We're monitoring SEMA for call out.
Okay, we know if there's any injuries or?
Nothing. They sent us absolutely nothing. What we know is because we called our emergency manager, and I guess he called somebody at the plant, but he hasn't called us back with any updates or anything yet.
Fire department on scene?
Not our fire. They've got their own fire department.
Just internal?
Everything internal right now.
Okay, thank you so much.
No problem.
Come over.
Dispatch Brandy.
Brandy, Robert in here.
Hey.
You guys get a hold of anyone at ITC yet?
We did not, and SEMA just did a call out for an engine only for assistance.
Engine only?
Yes, sir.
Special call, okay.
Yeah, FEMA special call. I was writing it down as you guys were starting to call in.
Okay, I've tried reaching out to the plant manager and to their emergency response guy, but neither one of them are answering.
Okay, and we still don't know what the chemical is.
Right, they finally did an emerge.
Yeah.
Okay, I'm gonna keep trying to reach out to them, try to see if I can get David Wade to respond out there.
Okay.
From Harris County and, see what we can get. For now, I mean, it's just a five.
We'll play one last minute.
Hello. There, per fire, 411's on scene. He's met with FEMA command out there. They're issuing no shelter in place at this time, but they're defensive fire mode. And according to Philip, it is a nasty chemical, but that is all we know. We have no chemical name.
Okay, so Philip knows it's a nasty chemical, but not the name?
Yeah.
Okay, who is gonna get that information for us?
We're working on that still. I will let you know as soon as I know something. I'm just getting the latest update.
Okay, I'll call him and let him know.
Okay,
all right, thanks.
Bye.
And so I think that just gives you kind of a little feel of what was going on when this huge fire was breaking, and it was about an hour before, and in some cases an hour and 15 minutes before other emergency personnel knew actually what the chemical was. There was another call from basically a dispatcher that they were sending traffic units, and they wanted to know what chemical they were sending basically their deputies to, and they did not know the answer. And this is a question. So I was talking to someone from the industry on background, and they were saying, you know, our priority is to fight the fire at that point and not to notify the public. And so, you know, you do balance like when is too much or when is too long to notify the public. Because, for example, for me, I'm a healthy, youngish individual, and probably I would have been fine. But if you're a part of a vulnerable population, if you're pregnant, if you're a kid with child with respiratory illnesses, I mean, our thresholds are very different, right? So I think the conversations of when to notify the public and what information to provide, they also worry, you know, what if we provide wrong information? And we worry people, and there's some that I had talked to with, for example, with a group of public citizens that said, you know, they encourage localities to provide as much information as possible, even if it has to be with the caveat of, these are preliminary results. We don't know if that's going to be the case or not, if we can shelter in place, or, you know, kind of like when we have an action ozone day where they say, try to limit your outdoor activities. I don't know if that might be one of the possibilities. And the information gets even more limited for non-English speakers or the elderly or someone who might not have as much access to the internet. And so today there was a report from the Chemical Safety Board, their final report on the DuPont incident from back in 2014, where 4 employees died, also from a chemical release. And one of the criticisms with the emergency response, so again, they did not know what chemical they were dealing with. You have the 911 calls where they had the security guy from the main door call 911. He's just saying, have 4 workers that are missing, we need rescue. Then he calls 10, 15 minutes later, and they say, like, do you know what chemical you're dealing with? I don't have that information. So it doesn't seem to be isolated to ITC, and I think that has to be part of the conversations that follow either at the state and local levels of how do you better share information, how do you better readily have that information, what chemicals are dealing with for first responders and neighbors. In terms of the barge collision, it has been mentioned here, the high level of fencing. So I was talking to, I think, one of these groups who talking about the data results, and they mentioned the fencing level and trying to figure out what that meant. And I would call the unified command, and they're like, well, I'm not sure about that. Then I would call TCEQ and try to figure out if you had such a high level of reading, what would be the protocol to inform the community, even if you cannot record it again in 1 hour, you know, because they're saying, well, 1 hour later we did the test again, nothing showed, but it's so high that wouldn't that merit some sort of information sharing? And the Unified Command said, well, TCQ didn't let us know until hours later, and at that point it was not replicated. TCQ then said that they did post something on social media, but I found the post and it was 15 hours later. And so I think, you know, when incidents like this are happening, the need to better coordinate, to share information, and even just what the readings mean, because it could be possible that maybe it was a mistake. No other entity replicated that reading. It could be that it was error, But if you're putting it out there, either verify it or then notify the community just in case that reading is accurate. And I'll stop there because I know we have one more person. I think you probably have questions.
Thank you. Yes, we have one more speaker that came on board a little bit late in the process, but we're very happy she's here. Dr. Sherry Onyego, I hope I pronounced that right. She's with the Harris County Environmental Health Office, and she's going to give us her perspective on a variety of things related to these incidents.
Good evening. Thank you so much for the opportunity for the organizers of this gathering to really be a part of this important discussion. I'm Sherry Onyego. I serve as the medical director for Harris County Public Health, our nutrition and chronic disease division, and also serve as an alternate local health authority for Harris County Public Health. First and foremost, Harris County Public Health remains committed to the health and safety of the community. I would echo a number of the comments that have been made by a lot of the speakers here. We shared some of our efforts, and we, even with the response as well as the communications and the partnerships with the monitoring. So in the best interest of time, I won't repeat a lot of the things that were already said. But I do want to just highlight some of the work that we did as it relates to the ITC Deer Park incident. We were not able to really comment on the barge collision, since that really was more of a City of Houston response and not a Harris County Public Health response as an agency. Harris County Public Health carried out several environmental monitoring processes, including healthcare surveillances and public health communications, including outreach and clinical health screening activities, as was mentioned earlier. Those activities were really to assess and respond to the incident in question at ITC. Harris County Public Health was especially focused on benzene due to a leak that occurred from one of the storage tanks, as you know, that occurred on March 21st. Based on the scientific evidence and consultation with guidance from our own internal team at Harris County Public Health, as well as those from subject matter experts from across the federal level as well as the local level, as well as academic partners. We had federal partners from the CDC as well as the Agency for Substances and Disease Registry, the National Environmental Health Association, the Association of Public Health Laboratories, as well as academic partners here locally, including the University of Texas School of Public Health and the Southeast Texas Poison Control Center, as well as a number of other partners. Harris County Public Health determined, in collaboration with all of those partners, that there might have been only immediate or acute, short-term, mostly minor health effects related to the fire, but especially for those living in the surrounding area of the incident. And that was with more of a special concern to those vulnerable patient populations, as was also mentioned here earlier. And by that we mean those elderly, children, those who have compromised immune systems, as well as those with chronic medical conditions. However, these were likely to be short-lived in nature and related to the acute exposure. Community members were reminded and advised to seek care from their healthcare provider for individual consultation, and where no such provider was available, Harris County Public Health really made a particular impact to the public to contact the Harris Health System, which was a vital partner for us in this response, as they stood up their own response in coordination with the Harris County Public Health. They set up their Ask a Nurse helpline in order to get more health-related guidance out to the community. The likelihood of long-term impact of benzene exposure from this incident has been deemed to be minimal based on the length of the exposure as well as the amount of the exposure. And again, that has been in communication and in consultation with a number of those federal partners as well as those local partners that I've mentioned. The determination was made utilizing the Occupational Safety and Health Administration standards regarding the amount of benzene exposure, which is more stringent than the EPA standards. Community members, again, have been and were continuously advised to seek care from their healthcare provider for individual consultation. And as was mentioned a little bit earlier, we did stand up some mobile health responses in response to the Deer Park incident. We were actually in Deer Park immediately after the event, right in the community. We stood up an ad hoc clinical health screening activity in partnership with the Harris Health System as well as the Harris Center for Mental Health and IDD. And others to assist with addressing those concerns that were coming directly from the community members, particularly those areas that were surrounding the ITC plant. And those community members were advised to, again, to not only to come to seek care for the health with our healthcare team. We saw close to over 970 community residents through those 3 stand-up events. For those individuals, the primary concerns were really those that were focused around some of the symptoms that have already been mentioned. Harris County Pollution Control as well mentioned a lot of the efforts that they were doing as it relates to the monitoring. We are for those specific air responses in partnership with the Harris County Pollution Control Services, the Fire Marshal's Office and others. Harris County Public Health assisted with community air monitoring efforts through the collection of air monitoring data on the VOCs using those handheld monitors. And we're happy to see the renewed interest or the continued interest in this environmental quality and justice issues. We remain committed to ensuring that community members have the same opportunities as everyone, especially as it relates to improved health and health outcome. We strongly believe that investing in public health because of these very issues and concerns are a priority, and that environmental justice remains a priority for our organization and for our agencies as well as the communities that we serve.
Thank you very much. What we have here is a bunch of questions from the audience, some to specific folks up here on the panel, and some that are kind of general that I'll allow somebody to stand up and try to answer, or if I don't get anybody, I might point at someone, but we'll try to answer as many questions as we can. We're going to post all the questions and ask for, anyone, some of the panelists can reply later on because we got quite a few questions. Some are repetitive. One thing I want to do first, though, is try to just summarize some of the things that I got from these presentations. We heard there's a need for more monitoring during these incidents. And I strongly agree with that statement, that sentiment that's been stated by several people up here as well as some folks in the audience. Also, the need for transparency, not only in some of these data and indices that are presented, but also in the raw data, which allows technical types to do their own analyses and determine whether they feel or have come to the same conclusion. Also, a role for citizens in monitoring and nonprofits are needed, but we're woefully underfunded in terms of numbers and types of monitoring applications that are available to us to deal with, high risk of chemical exposure. Also, a need to use the correct exposure levels. We've heard everything from 8-hour to 1-hour acute, and that confuses people. And certainly might be misrepresenting the true risk of humans from exposure. And we also, related to this, we need to translate this into terms that the public can understand, that they can make decisions regarding the risk. And so I call it toxicology for public. You know, how do we translate this sometimes highly technical jargon into something that people can act upon? That brings up the topic that how do we handle these emergency chaotic situations, because they are emergencies. There's always an element of uncertainty early on that people might construe as, oh, they don't have their act together, but maybe not. And so how do we educate citizens? Similar to how we deal with hurricane preparedness, is there a need for something, how do we deal with chemical exposures and accidents? We do have some mechanisms out there. We have community advisory panels that petrochemical industry participates in. That's perhaps one mechanism. There's the LEPCs, and maybe they need to do a better job of reaching out to the general population. How do we weigh the accuracy of information that's coming out versus the need to act? You know, do we release preliminary data, the qualifiers as was suggested, so that people can make a decision, albeit based on limited information, or do we wait? Knowing this is preliminary information. And also, since people constantly are moving to Houston, do we need to periodically educate people? You know, they're not all from here. We need to be educated in hurricanes. They need to be educated on risk associated living next to a chemical corridor. And so those are just some thoughts that I came up with that perhaps deserve some additional attention, and certainly were things that folks brought up. What I'd like to do now is move on to the questions and return to some questions perhaps that some folks had. Doug, one more? Oh, okay. I like the first question here, and I don't know who to direct it to since they're not here, is why isn't EPA and TCEQ here? That might be a question for Doug. Weren't some of them invited?
I'm not sure about it, but Tony's here. Here you go.
You want this one?
Yeah, I'll just say that I tried really hard to get them here. I tried every trick in the book. I invited them, told them who I was. I invited them, told them who I knew. I invited them and said I talked to our state rep. Actually on TCQ, it was interesting because first off, the Houston office said, yeah, we can probably do that. Let us work that a little bit. And they were working it and getting back to me. And then an earlier call to the state office, they responded and said, no, we're too busy to do that. They really said that. They're too busy to do that, to talk to the public. But then they changed and said, well, we can't do that because several of those items that you brought up are in litigation. So, tried. But that is the essence of what the communication problem is.
They work for Exxon, not for you. Yeah, that's what they told me.
Okay, next question is, in matters of evacuation, who decides and what are the criteria? Anyone, I assume maybe from the county, might shed some light on that?
What was the question?
What was the question?
It says, whenever you have an incident like this, chemical release, who makes a decision regarding evacuation? What are the criteria?
Okay.
Nobody.
So in terms of shelter in place, the Houston Chronicle did a story that there's no precise guidelines. It's kind of left up to each locality, and they try to use information from their emergency response and from, try to coordinate, but it depends totally on the local officials and to decide. So there's no uniformity in terms of guidelines as to under the circumstances. They say that they try to look at the totality of the issue and decide if that's a good course of action. And then there's someone from the county, so better respond.
Okay, thank you.
Oh, and this also brings up what is a real legitimate problem, just like flooding across jurisdictional areas. You got a lot of different jurisdictions. I thought you were.
No.
Nope, nobody's going to take that. Okay.
Okay. This question is: has anyone taken tissue samples from either spill? If not, why? I don't know if that's human tissue or animal tissue.
Any kind of tissue.
Seafood. Seafood. Okay. Seafood. Anyone wants to try to answer that? Texas Department of State Health Services isn't here.
I know that Parks and Wildlife collected some catfish right after the ITC incident, but they chalked up the whole fish kill to a virus. So I don't know if they actually processed them in response to the ITC, but they were collected, but we haven't seen any data from it.
The fish are still in a freezer waiting to be tested for an indeterminate contaminant, depending on what some of the water testing has found. Also dependent on funding. So Scott has, yeah.
Help from the audience.
So I'm Scott Jones. I'm also with Galveston Bay Foundation. I just want to let y'all know we've talked about the inadequacy of the monitoring for the air. I also want to let you know that Texas does not do regular testing on seafood for toxins. They rely on grants from the EPA or the Galveston Bay Estuary Program. We had a legal intern look at 9 states around the country that have a lot of fishing licenses sold. We're the most. We're the only state that didn't have annual testing. All the other states had annual testing. So talk to your legislators, your state senator, and your state rep. Tell them we want regular testing for toxins on seafood.
And that's exactly the right kind of thinking about everything you've heard tonight. This is all information. There's more information out there for sure, but this is enough to trigger action and to contact elected officials. There are a whole variety of elected officials. State Representative Dennis Paul, House District 129, Clear Lake area. I begged them to come. I begged him to come or send staff. Sorry.
I just want to add to what Scott said. In a previous life when I worked for various state agencies, TCQ, TPWD, and we did a lot more monitoring. Almost every time we did some monitoring, we found something that we did not expect. And so we really need more monitoring, in my opinion, baseline monitoring, not necessarily even associated with a particular spill. That's my 2 cents.
And this question brings up a challenge that we at Galveston Bay Foundation have been facing in light of these incidents, in that we've been receiving phone calls from the public wondering whether or not it's safe for them to be eating the seafood in the bay. And immediately after both of these incidents, there were seafood consumption advisories that were put in place and have since been removed. And those were not even based on testing of seafood. And they were not removed based on testing from seafood. It was just ongoing ambient water quality monitoring and best judgment. And so we don't want to necessarily be telling people that it is safe, because that information is not out there. But there are also no advisories in place regarding these incidents right now. And so it's a tough issue to balance. But
safe to eat usually.
Safe to eat, yes.
Yeah, I got the same.
Yes, safe to eat, sorry.
Same request somehow. This next question is directed specifically to Dr. Pavan, and the question is, why was ITC allowed to start up without a modern fire suppression system?
Lots of love. 50 years old?
When you say startup, you mean from the incept of their facility? I'm not really sure I understand the question.
Who's the
why were they allowed to go back into business and start doing their regular business? Oh, after the incident.
Oh, after the incident.
After the incident, yeah.
Well,
They don't have any fire suppression equipment out there, really.
The state of Texas allowed them to restart. That's really the answer.
Yeah, they have permits to operate.
I'm sorry, say it again?
Is that the TCE?
Yes, sir.
Okay, thank you.
As we say in the Sierra Club, the TCEQ never met or polluted anyone.
Okay, the bulk of the discussion and the government interest in these pollution events address response to pollution events, compliance, monitoring, cleanup. What can we do to prevent these events rather than just react to them? Anyone would like to venture into that territory?
Shut them down.
I got it.
Well, one thing they can do, specifically related to tanks, there are a lot of different ways to monitor tanks and do inspections. And as was mentioned, this is an old facility. I haven't been able to look at the permit. I just noticed that TCEQ permits are no longer online. You have to go to the central file room like you did 20 years ago to review permits. So there are the technology that's used in the aspect flyover plane, the infrared technology, is a very good technology for detecting leaks. And it's particularly useful for tank farms. You don't need an airplane to do it. There are some chemical plants that use it, and you can basically have it, it looks like a large movie camera, and you can point it at the top of the tank, and you can see the difference in the image will tell you if it's leaking. So there are different ways that you can do leak detection on a broader scale. That's different than just going to every single tank and with a handheld monitor. I believe I saw another presentation from the city of Houston where they were recommending drones. So you could attach these cameras to drones and go by and do inspections either by the facility owner or by a government agency.
I'll just add, TCEQ can fine them more. I mean, it's an economic decision, and the fines that often get levied, if they ever do, are really not enough to move the needle at all. And I mean, to add some of the monitoring systems, to add more, to add better pollution control, to shut a facility down so that you can check the pipes to make sure that there aren't leaks or corrosion. All of that costs money, and companies are going to do a calculation, and if what they're going to save by not implementing those solutions is going to be worth it relative to what they could be fined if they're caught, then they're always going to pick that. And so that's the long-term solution. I think it also involves, we've got local government that, especially as of this last election, is much more interested in doing more to prevent these accidents, but their power is limited, and so making sure that we get power back to local authorities so that they can take on these facilities as well to try to change that calculation is another important piece of it.
I can talk pretty loud. We're running short on time. We're supposed to be out of here in...
We have 5 minutes.
Okay, so I'm going to try to hit a couple of real quick questions, and then we have time for some questions. But these are things I think we can answer pretty quickly. If I smell something, who do I call?
Ghostbusters.
No.
Who are you going to call?
So if you smell something, as I indicated in my presentation, you are our eyes and ears. Give us a call at 713-920-2831. That is our complaint number, and we will send an investigator out to do an investigation so we can follow up. We do odor surveillance that we try to track the odor back to an originating source, and if we are able to